Good morning. Welcome to day 85 of the DeStress Countdown, Quantum's Liberty. Good morning, buddies. There's your water. Today on the phone, we have Rebecca. Rebecca is from Michigan. Her mom is a critical care nurse at the Butterworth Hospital in Michigan. And so they're going through some unprecedented times, and we're going to be doing some tapping on some confusion that Rebecca was talking about. So let's start tapping. The confusion was about a lack of consistency with healthcare public officials' statements, and so I thought what we did with Rebecca is she knows from her mom that the hospitals are overwhelmed. They work within a system called the Spectrum Health System, and so they've been communicating with their policymakers to say that what they're worried about is that the staffing is not adequate. They can always build more beds, but they don't have enough staffing. And the rates in the last 3 weeks have doubled and doubled. And so their ICU beds are at 85% full. Let's see, that was like 6 days ago, so it's probably worse now. But they are seeing a spike that is going straight up for hospitalizations and for deaths and for cases. So imagine their surprise when Dr. Scott Atlas asked them to rise up and battle up against the public health officials' recommendations to have a lockdown to help ease the problems that are occurring in the healthcare system. Luckily, Stanford Healthcare, where Dr. Scott Atlas came from, and he's affiliated with the Hoover Institute through them, and he writes on government affairs and public health, and so he's a respected doctor. But the Stanford News, their report said that they do not stand with Dr. Scott Atlas. They do think that the public health officials and the experts in Michigan ought to continue to advise the policymakers. And so they did say Stanford said we do believe that we ought to have strict adherence to mask and public distancing and washing your hands. And so as of yesterday, the nice thing is that with all that communication from Stanford to Michigan, the Michigan governor initiated a lockdown, I think beginning tomorrow, and that's going to be for 3 weeks. So hopefully that will follow the path of France. France did an excellent job and went on lockdown a month ago. And as of 2 days ago or yesterday, they saw a decrease in the number of deaths and cases. So that was a wonderful thing that happened. And they're going to do a lockdown for 2 to 4 more weeks. And then maybe they'll open just slightly just before Christmas. So these things, although they're annoying at first, they will help us to help our healthcare workers, because there's not enough of us, right? To staff. That's what these hospital officials are saying. So you can read the article. It's in the references. So let's tap on beautiful health. Even though I have this resistance to perfect health, repeating after me, great, Rebecca. Even though I have this resistance to perfect health because of the confusion inside of me, I deeply and completely love and accept myself. Even though I have this resistance to radiant health and I'm confused about what I should do to stay healthy, I know I can listen to my health experts and trust them. And I deeply and completely love and accept myself. Even though I have a little bit of resistance to radiant health inside of me, I deeply and completely love and accept myself. This resistance to radiant health, any and all resistance that I have, it's hard to trust health officials. Luckily, Stanford came out with a public health safety team. This public health safety team is directed by an athletics and a psychology expert. One of each. This is to provide safety at Stanford so that we can all trust one another. I envision myself in radiant health. I see myself walking and talking in radiant health. I am that person. I have this radiant health. I perceive in radiant health. I walk, talk, and believe in radiant health. I am that person in mind and body and spirit right now. Thanks, Rebecca. I'll check in with you